Have you ever been wondering what happens in a case where a woman does an ultrasound scan and it said she has twins, and after another ultrasound she discovers that she's carrying only one baby? What is happening? Was it the fault of an ultrasound scan that didn't see the second baby, or what was happening inside the womb of this mother? So this is what we call vanishing twins, disappearing twins, or reabsorption of the twins. So what are the causes? What happens inside the womb before this occurs? This is what we're going to be talking about in this video, so do not miss out on this episode. And if you're new to this channel, this is Talk Pregnancy with Dr. Nuella, where we'll tell you all about pregnancy and other women related health issues. If you have not subscribed to this channel, please click the subscription button and also the notification button. To those who have subscribed, thank you very much. So let's dive right in. So disappearing twins occurs when one of the baby dies or the woman has a miscarriage of one of the baby. So how can you know you have a disappearing twins? This occurs when a woman does a first trimester ultrasound, for example, and sees that she is carrying two babies. Then maybe during the second trimester, she does another ultrasound and sees that she's having one baby. That means one of the baby died or she miscarried one of the babies. So now she is having one child. Or sometimes occurs in women and they don't even know that they have had this kind of condition, especially in women who didn't do the first trimester ultrasound and maybe ended up doing a second or a third trimester ultrasound and just see just one baby. They might not know that they had a disappearing twins. In this kind of condition, most of the times it is usually diagnosed maybe after delivery of the first baby. Then they see that there are some particles and they want to deliver that other or remove the remaining particles in the womb of this woman, and they discover a small baby that was there who had died earlier on. So in this case, we might inform the mother that this is what happened. Disappearing twins occurs in about 36% of twin pregnancies. So it is something which is frequent, and it occurs more in women who have had an in vitro fertilization. So you can see that this is something which is happening. Many researchers are saying that this is even occurring more than we think. So it is because most of the times it is not really diagnosed. What therefore increases a woman's chance of having these disappearing twins? If she has had in vitro fertilization before. In vitro fertilization, multiple embryos are being inserted into the woman, which maybe one can die. And what happens with these disappearing twins before maybe a twin can die? A lot of competition, fighting for space, fighting for blood supply, fighting for nutrition, and fighting for many things inside, where one finally gives up and the other one turns to grow. In women also who are of age, above about 30 years of age, if they have twin pregnancies, there's a high risk of them having a disappearing twins. Also, there are genetic factors and chromosomal abnormalities which can affect maybe one of the baby. And in this case, when one of the baby is affected and maybe that one will not grow well, so in this case they turn to die. And with these chromosomal abnormalities, especially if it is a very severe chromosomal or genetic abnormality, this baby will not survive. So the baby turns to die, and then the body of the woman absorb this baby. How can a woman know that she has had a disappearing twin? The signs and symptoms this woman can have: she might have some spottings during that's bleeding, or some abdominal cramps which can occur when she miscarried. But these are some common phenomena which happen normally in normal pregnancies, especially during the first trimester of pregnancy. So it is very difficult to really have a direct symptom that will tell you that you have a disappearing twin. What is done if a woman had twins and now we discover that it is one baby? This is actually a situation where I met just last week, where we had this same case where we had to manage this woman. This woman came and we did an ultrasound scan. This woman showed she had one baby, but out of a sudden she had a little bit of complication. So we sent to redo another ultrasound scan, and behold, we're told that they're twins, and one of the twins had died already and was already crushed and at one position. So in this kind of case, what can we do? Definitely you do nothing. What you just do is to observe the pregnancy and make sure that the surviving twin is alive and healthy, and make sure to do constant follow-up of this pregnancy. If the mother has any complication, she should report immediately, but here nothing is to be done. And most of the times during the first trimester, if it occurs during the first or second trimester of pregnancy, here the body has a system of reabsorbing all the waste in the body, so that is considered as a waste product in the body. So the body tends to reabsorb this other baby, and now this woman has just one baby. So if this was helpful, give a thumbs up to our video. If you've learned something new, still give a thumbs up. And if you want us to discuss about anything, or you want to book a private consultation with me, you should click on the link below and book a consultation with me. We have done a lot of videos on twin pregnancies, how to get pregnant with twins, what are the things that increases your chance of having twin pregnancy. So after this video, go back to that video and watch more on this. Thank you very much. God bless you.